With the combination of both the exercises and the MaternaLIFT, the symptoms I was having disappeared and I was much more comfortable.
I've tried the pelvic belts and everything else, and all that it felt like it did was squeeze the area that was hurting, and it didn't really seem to offer any relief. I started wearing the MaternaLIFT suit, and for me that was absolutely incredible, and I really wish I found it earlier in the pregnancy.
I really feel more empowered now to tell women this isn't something you just have to live with. There's things that we can actually do to help you, or things to fix it. When I walked out of here, I was thinking, wow, it's that simple. I mean, it's kind of ridiculous that women suffer through so much discomfort and pain when really it's fairly easy to fix it.
I'm Kevin Hansen, obstetrics physical therapy specialist and developer of the MaternaLIFT two-step home program to relieve pregnancy-related back pain. This home program was originally developed for my own patients and consists of 2 action steps that work together to provide both instant and lasting relief of your pregnancy-related pain. The first step is a specific corrective exercise done to reset your upright pelvis. The second step is the added use of a new type of maternity support called MaternaLIFT to help support your upright pelvis as you function throughout the day. Before we learn about the underlying cause of pregnancy-related pain and why supporting the upright pelvis is your key to effective relief, let's begin by visiting with a few of my patients to hear the stories of their pregnancies, stories that tell of the pain they've experienced, and their stories of success in using this two-step home program to get relief.
My name is Amy and I'm a teacher. I'm currently 34 weeks pregnant with my second child. During my first pregnancy, around 20 weeks, I started experiencing discomfort in my hips, especially at night when I was trying to sleep. When I saw my OBGYN, he referred me to Kevin Hansen, a physical therapist. And when I saw Kevin, he noticed that I had stress on my pelvis due to the pregnancy and recommended corrective exercises. At first, I was a little skeptical that exercises would be enough to help my problem with my hips. But after a couple weeks, I noticed great relief, and they were easy to do. I could do it twice a day, and it solved my problems. When I got pregnant the second time and started experiencing the same symptoms, again around 20 weeks, I came back to see Kevin Hansen and just thought I'd get a refresher on those exercises and that would be enough. But I noticed a couple weeks into it that I still wasn't experiencing the relief that I had the first time around. At that point, Kevin recommended the MaternaLIFT, and I thought, well, I'll give it a try. And when I tried it, I was surprised that with the combination of both the exercises and the MaternaLIFT, that the symptoms I was having disappeared and I was much more comfortable.
I'm a certified nurse midwife and a women's health nurse practitioner, and I work in the area. So this is my third pregnancy, and I obviously see a lot of pregnant women during the day, and I work full clinic days, and I'm on call and I deliver babies. So I mainly see women for prenatal care, but I also do full scope women's health practice. I hear a lot about pelvic pain, back pain during pregnancy, and having experienced it myself, I can empathize with women, how disturbing it is to your daily life. Pregnancy, although it's a wonderful thing, is really difficult. It's hard. Whether it's sleeping or nausea, or it's one thing or it's something else. But I feel like back pain is one of those things that I hear a lot about. When I was pregnant with my second baby, I got to the point where I could barely walk, and just because of my pubic bone pain and my back pain, and it was horrible. And that was one of my hesitations with thinking about having another baby, because I just thought, I can't do that again. It was horrific. So once I started having those same sort of feelings and the pain was starting to come back with this pregnancy, I made the lovely decision to come see Kevin, kind of preventatively. And you just went over the exercise with me that basically just changed everything. I mean, it's allowing me to work longer. I feel better. I feel more like myself. I'm not moaning all the time when I'm changing position. I can sleep better. It's impacted everything. So I really feel more empowered now to tell women this isn't something you just have to live with. There's things that we can actually do to help you, or things to fix it. I feel like coming in to you and learning the exercise has made a huge difference.
Could you talk a little bit about your trial with the MaternaLIFT?
Yeah, so I wore it a couple, 5 days ago, and I worked 16 hours and I was on my feet pretty much the whole time, and I felt really good. I mean, at the end of the day, it was just normal pregnancy stuff. My feet hurt, I was tired, that kind of thing, but my pelvis felt great, and that night I slept really well, which usually after being on my feet that long, I'd be kind of achy and sore and would expect to not sleep very well. And then the great thing was the next day I felt just as good, and I actually took a day off from the MaternaLIFT. So I think it obviously held everything together and tilted my pelvis in a way where I was able to walk around all day, get my job done, see my patients, take care of my kids when I got home, and just kind of live my normal life.
Despite the differences in each of their circumstances and symptoms, there are two main points that apply to these women, to most women experiencing pregnancy-related discomfort, and likely to you. The first point is that the same fundamental pregnancy-related stress, the forward rotation of the pelvis, was the underlying cause of their discomfort. Can you feel how your pelvis rocks forward and downward in response to your baby's growing weight? Allow your pelvis to rock farther forward. Notice how this movement increases the stress on your low back, pelvis, hips, and legs. This forward rotation of your pelvis is the underlying cause of most pregnancy-related pain. The second point is that by focusing on resetting and supporting their upright pelvis, they were able to get sustained relief of their pregnancy-related pain. Try rocking your pelvis backwards. Do you feel a sense of relief as your belly is lifted up, the curve in your low back flattens, and your tailbone is tucked underneath you? By addressing this fundamental stress using the MaternaLIFT two-step home program, Amy, Laura, and Amber were able to get sustained relief of their discomfort and despite their varied symptoms.